Today, we will be talking to prosthodontists from various backgrounds to tell you more about our specialty and why they choose to become prosthodontists. So, hope you guys enjoy it. I'm going to start by introducing myself. Um, I am Dr. Bhavika Thakkar, and I graduated dental school in 2009 from India, MGV Dental College. After which, I did go into private practice where I did learn that prosthodontics was something I wanted to explore more. So I did my post-graduation in aesthetic dentistry from New York State University, Buffalo, followed by a fellowship in prosthodontics from Rutgers, after which I did join my post-graduation in prosthodontics and graduated from New York University in 2018. So as you know, from 9 to 2018, I have been in between in private practice. So I've been a general dentist for a few years, now been a prosthodontist from 6 years with a total of 13 years of experience. I was a full-time faculty at UMKC after I graduated from NYU. I then directed the fixed prosthodontic course at UMKC and was the fixed prosthodontic course director for the lecture and the lab, along with the assistant interim director for the AGD. And I did teach the students in the preclinical and the clinical labs and lectures and the clinics. This is where my career path has shaped me, and I am now into private practice and would love to introduce my colleagues.
Hi, I'm Dr. Kevin Lassiter. I'm a prosthodontist in the United States Army. I graduated dental school in 2013 from Midwestern University in Arizona. And then I immediately joined the United States Army. I was a general dentist for 6 years and then found my way into prosthodontics. So I started in 2019, graduated in 2022 from the United States Army prosthodontics postgraduate dental program. And then since then, I've been stationed in Georgia as exclusively as a prosthodontist now for the last 2.5 years. I'm coming up on 11 years of service this summer. And I'm excited to share my experience treating a different patient base than many people are used to.
I am Ruhanijot Cheema. I received my Bachelor of Dental Surgery from School of Dental Sciences in New Delhi, India in 2013. Went ahead and pursued a 3-year specialty training in conservative dentistry and endodontics at the same school with a decade of private practice in the capital in India. I went ahead and pursued a next second master's in dental implantology from Universidad Católica San Antonio de Murcia in Spain. Currently, I'm a third-year resident in advanced dental education in prosthodontics at University of Alabama at Birmingham.
I would like to go ahead and start the roundtable by our first question, which is, what made you choose to specialize in prosthodontics? So if Dr. Lassiter, you want to throw some light on that, that'll be great.
Yeah. So I think a lot of my decision to specialize in prosthodontics came from almost a lack of knowledge and experience that I had throughout my early career, dental school, and immediately after dental school. I had a good experience at my dental school. It was brand new at the time. I was the second class to graduate, and so we didn't have a prosthodontic faculty until end of third year, beginning of fourth year, and so I didn't have a huge understanding of what the field was, and that kind of showed itself evident to me once I got out and started practicing on my own. I did have a positive experience. I did an AGD program immediately out of dental school and had a exceptional prosthodontist there. And his attention to detail, perfectionism, just absolute wizardry of a brain. I didn't think I could ever get there. And so I was just like, oh, that's for other people. That's not for me. And then, as the years went along and I started challenging more, I started taking on more challenging cases. I quickly realized I was maybe in over my head on some of them. And I was like, there's got to be a way to do these things better. And so I started doing continuing education with some prosthodontists in Europe at the time. Ed McLaren and Stavros Pelikanos were two guys that kind of mentored me for a period of time. And they both said, if you like doing this stuff, you should consider going into prosthodontics. And I never thought about it before then. And so um, little by little, I started, expanding my knowledge and realized like, if I want to get good at this kind of stuff, that's what I need to be doing.
No, that's really great, and thank you for sharing your path or experience to it. Dr. Cheema, can I have your input onto why did you choose to specialize into prosthodontics?
A very similar, I think, pathway to Dr. Lassiter, although we were in different parts of the world. But I do believe that I was the second class myself from my dental school, and I think we graduated around the same time, 2013. So I was 2008, I believe, or 9, second year. So, after graduating, and I was passionate about aesthetic dentistry and endo at that time, but being in private practice and being in a faculty position for several years, I realized that a more comprehensive, wanted to dedicate my rest of my life to more of my whole stomatognathic system rather than just being more mechanics. And like you had a mentor, I had a true mentor too, Dr. Douglas Terry. He told me to, that I think you should go in for prosto, and that was something I wasn't planning, but I think this was my true vision, which I wanted to see myself as planning the entire patient and taking as whole a comprehensive oral examination and treatment planning. So that's where I am.
That's great. To add on to that, I would like to also add on why did I choose to become a prosthodontist? And as all our paths are similar somewhere down the line, when I did my fellowship in prosthodontics, that was when I knew by practicing as a general dentist that those are the things that I liked. I liked implants, dentures, fixed prosthodontics. So that was the way to go. And after doing my fellowship, I got such a great response because I went into private practice for 3 years, and the kind of cases that I was getting were pretty complex. And 1 year of fellowship is not enough to learn the complete prosthodontics, which is when, I had a mindset of, I want to go ahead and do a post-graduation. And the goal was to become a member and the fellow of the ACP. That was my start goal from the time I've started. So, and adding a smile to people's face, whether it's from just a complete denture to a full mouth reconstruction. I always love challenges, and I think prosthodontics is a great branch if that's what you're looking at, being the drivers of your treatment plan to go ahead and specialize into. Moving on to our next questions as to what has been our experience like during residency. I would go ahead and turn around to Dr. Lassiter for him to throw some light on that.
So I had a great experience in residency. It was challenging. I knew it was going to be challenging, but it was more challenging than I expected it to be, in a good way. I learned a lot about myself, which was important, especially, trying to manage residency and life and family and everything else. So our clinic is unique. It has endodontics and periodontics in the same building. So there is an excellent ability to treatment plan multidisciplinary care, having patients walk down the hallway to go get their immediate implants and come back for the restorations. So working with other providers was one of the highlights of the program. I think what the program does really well is give a strong foundation in literature and treatment planning, which I knew I was deficient coming into the program. And we read a lot of literature, which was good, classic and current. We did all of our own lab work, which was also something I'd never done in dental school as well. So I was grateful for learning all the different steps and techniques for fabricating essentially any restoration that we needed to. I found out that there were things I liked and things I didn't like in the lab. And so I still focus on the things that I like these days, and I delegate what I usually don't like to people who do it better than I do, which I try to do as much as I can. That's why I don't do root canals anymore. But yeah, and then the patient base was something that I truly enjoyed. So we see young active duty military kids. We see people in the middle towards the end of their careers. We also see retirees at my program. So we had a tremendous variety of treatment options that we would run patients through, and a great ability to take care of people who've served our country and people who are currently serving our country as well.
I think we all had quite similar experiences with that. Literature review is pretty strong. That is a great positive thing that, I've learned too. And doing your own lab works, let us take over and let the lab know in case if something has to be modified or changed. We can look at those aspects as we've done it on the analog, and now the same thing moving to digital. That really gives us a great perspective because we have done that by ourselves, extended hours, and I'm sure we've all stayed 12 plus hours, 14 plus hours during our residencies, spending time clinic and lab. So thank you for sharing that. And I will move on to Dr. Cheema, who is right now in her third year residency, almost about to graduate. Tell us about your experience, and if anybody out there wants to go ahead for a prosthodontic residency program currently.
Dr. Thakkar, yes, it's a highly demanding and challenging specialty, and we truly get to know ourselves, our limitations, and our positives through the program. But I think a great mentorship through the program has keeps us going. Foundational knowledge has been the basics for our department per se, because with faculties reviewing classic literature articles every Friday, and with their experience adding their clinical knowledge to that. And as you said, as residents, we're coming to the lab as the first ones to school and the last ones leaving the building. So it truly is, but at the end, it's rewarding when you see those patients walking out happy with, starting with dentures or, full mouth rehab. So it's the attention to detail which I've learned during my residency, and I'm grateful. So it comes with its ups and downs, but I would not have it any other way.
Perfect, perfect. Well, thank you so much, and good luck to you from here on into your career path as a prosthodontist soon. To add on to these, my experiences have been quite similar too. I'm thankful to the New York University postgraduate prosthodontic department to have a lineup of faculty that was over 30 faculties, starting from the ones that have graduated and been into practice from few years to the ones that have practiced over 30, 40 years to some that are almost on the verge of retiring. So to learn from everybody, and I was more keen on knowing what has worked with everybody, what is everybody's techniques that they use, but then use it myself and come up with a technique which is probably a sum of 3 faculty, but now it's Dr. Thakkar or my technique that's worked in my hands. So that's a great learning experience you get during residency with interdisciplinary approaches. You do cases where you can get other specialties in hand and work with them. Also, you can work with general dentists to get certain things, which is simple things that they would do, and then just refer you the complex stuff. So that's been a great experience on it too. Moving on to our last question, which is how did our educational experience shape our career paths? And we are looking at a diverse background, from military to residency to faculty and private practice. So Dr. Lassiter, can you throw some light on shaping how prosthodontics has shaped your career path?
Yeah, definitely. So what it's, I think, provided for me is a sense of the ability to see and diagnose and understand a way to reach the final result that I have in my mind. I didn't have that before I started residency. I vividly remember a few cases that I did, some anterior crowns where, from a technical perspective, it went, wonderfully. And then once I stood back and had them smile, I'm thinking like, how did I miss this, or how did I miss that, or where was the disconnect in all of this treatment planning? And it gave me a sense, it gave me like a finely tuned vision of being able to see an outcome that I wanted to achieve, and then actually be able to reach the outcome I achieved. And so training provided me that. I'm grateful for that. And I'm still working on it. I'm not nowhere close to perfect, but that's what experience is for. And, I have a full career ahead of me to continue to press on and learn, develop my techniques, find good people to work with, and try to do the best work that I can do.
Perfect. Thank you so much. Wishing you good luck into the future endeavors that you go through. And thanks for sharing your experience.
Yeah.
Dr. Cheema, can you throw some light on how your educational experience has shaped your career path, and what are you looking forward to as you graduate?
I feel that coming from a background in endodontics and implantology, this has really joined that missing link which I had, in treatment planning, not just seeing, we're seeing beyond the second molar. I'm seeing airways, I'm seeing TMD occlusion, and the all of that together. So kind of planning with the end in mind. So having a prosthodontically driven treatment cases and planning accordingly. So that has something which I've learned through the program at University of Alabama, Birmingham. But all these continued learning from various faculty members and absorbing ideas like a sponge during residency, just like you said, and making that my own, what works in our hands. And truly, when we work with leaders across and leadership skills from people, we truly become leaders in prosthodontics by leading them. So I've been using that knowledge and to make patients have a better smile. And
that was great. Adding on to how it has shaped my career path is, I was in the prosthodontic residency when I used to go ahead and teach the pre-doc students, help them in the clinics along with one of my attending faculty. And doing that for a year or two, being a teaching assistant, got a great feedback from students. They want to learn, they want to know more, even if it's a simple crown, what it entails, resistance, retention form, not going into those details. But it was such a great response that they went ahead and gave me an Excellence in Teaching award, uh, along with my graduation certificate. That motivated me to go ahead and give back to the Prosthodontic Society by being and getting into academia. I love clinical practice. I'm a clinical person too. And for me, is prosthodontic residency has helped me connect those dots from literature to interdisciplinary approach to what is textbook to what is practical knowledge. So being able to, connect those dots and be able to teach the upcoming, dentist or specialist or prosthodontist or even advanced education students has made me feel good, and they've given me a beautiful, response to the way I taught as I went into becoming a full-time faculty right after my graduation. So one of my mentors during graduation told me that, this is one of the career paths. That's not the first job is not your last. So I wanted to go ahead and explore that with part-time private practice. And that has given me to interact with so many, students, other faculties, taking up leadership roles like, being the director, being the assistant director, and being able to pass on what we learned in my residency and thereon. That has now helped me shape my career path. And moving now into full-time private practice helps me articulate everything. Patients give us a great response and acceptance of the treatment plan. We could offer from something economic to dentures to RPDs to something complex to a full mouth reconstruction. So being able to help a patient, that is what we are here for as a specialty into dentistry. And I'm really grateful for that. So as we conclude our meeting, I wanted to ask each of our panelists to give one last sentiment on their thoughts and feelings about their choice to become a prosthodontist and choose this as their career profession. So Dr. Lassiter, do you have any last thoughts on that?
Yeah, it's definitely been the most challenging thing I've done in my career and education, but it's by far the most rewarding thing I've ever done in my career. So
Perfect.
that's why I'm grateful to be a prosthodontist.
Thank you. Dr. Cheema, would you like to have some last thoughts or sentiments on that?
Thank you, Dr. Thakkar. My motivation is the pursuit of excellence, and secondly, will this bring you joy to the future pros applicants? And those two answers are what you reply yes to. I think this is the specialty to pursue.
Perfect. Yes. So as we conclude, my last sentiments would be, or what I tell my dental students is, prosthodontics is kind of a super specialization. You learn deep into 70 to 80% of things that you learned in dental school. To keep up to that and, being able to deliver the kind of treatment plans and excellence to complex patient care is what prosthodontics is. And if you guys like challenges, if you guys like to, learn more, be meticulous about things, and, again, be the drivers of your treatment plan or be able to decide help through multidisciplinary approach, then this is the specialty you should consider taking. We have great mentors. ACP has been a great resource, from residents to great experience faculty to the board members. So please do consider this as a specialty. And we are moving from the analog to digital age, so you should still like some lab work in order to consider this, but it is advancing and moving greatly. So would encourage everybody out there to do that. And I would really like to take this last moment of time to thank Dr. Lassiter and Dr. Cheema to spend their time and take out time from their busy schedule to help us get this roundtable to you guys out there. It was great talking to you guys, great learning about you more, and being able to put it out there for other people to know too. So I'm really grateful and thankful, and ACP is too. So thank you so much for being on the panel.